Thank you so much, Isabel. Hi, everyone. Can't see your faces, but I know you're all out there. It's nice to meet you. Thanks for having me. I am a gynecologic oncologist, so I take care of women with cancers of the GYN tract. And so I wanted to talk about a lot of common things that come up in my office and clinic and everyday conversation with my patients. And I think this is really important because it's stuff that maybe we are all thinking about as women, but doesn't normally come up in everyday conversation when we're out and about. So I put a few slides together with things that I think or that I hear most commonly come up, and then hopefully at the end you can ask me questions. Anything that's not clear, please definitely ask me to clarify, and any of your own questions that you have, I'd love to talk about at the end as well. And so just to get started, I put this picture together. I don't know if can you see my mouse here, hopefully, but when we talk about gynecologic cancers, it's a small area where everything is connected, but there's actually many different kinds of cancers. And so if you look here at this picture, so this is the uterus, it's cut open so you can see the inside. This is the muscle of the uterus. Down here is the cervix. The cervix is actually really small. This is the top of the vagina. These are the fallopian tubes, and these are the ovaries. And so together, this, is really only about this big, like 5 or 6 centimeters big, but there's lots of different parts here that can cause problems. And so when we talk about gynecologic cancers, it really could be any one of these parts that's causing a problem. And each one kind of has different risk factors, and each one presents differently. So to talk about some of the most common ones that we see, so endometrial cancer, that's the most common cancer in the United States, actually, and almost 50,000 women are diagnosed just in this past year, and it's on the rise. And so just to go back to this slide, endometrial cancer is a cancer of the lining of the inside of the uterus, because that's called the endometrium. So you'll often hear endometrial cancer or uterine cancer kind of being used interchangeably, and they can mean the same thing. So I talk about endometrial cancer because a lot of the risk factors for endometrial cancer apply to a lot of women. And one of the reasons that endometrial cancer is on the rise is because obesity is also on the rise, and obesity is probably one of the biggest risk factors for endometrial cancer. And the reason for that is because fat cells in your body actually convert hormones, and they make estrogen. We don't really realize that, but it's a kind of another way of making hormones in your body that doesn't come from just the ovaries. And so all of those extra hormones act on the uterus and the endometrium and can cause problems. And so that's one of the biggest ways that obesity leads to endometrial cancer. And so I just put up some of these other risk factors as well. So hypertension, we're not sure why, but hypertension and diabetes are also risk factors for endometrial cancer. Nulliparity, so that nulliparity means not having children. So having kids is a protective risk factor for endometrial cancer. And then anovulation, so if you don't have periods, if you're not having regular cycles and your body isn't regulating as regularly, that's a risk factor, as well as the extra estrogen that I had mentioned before. Just put this little mnemonic Honda just to think about some of the risk factors. And I think that it's important to bring them up because a lot of them sometimes can be modifiable. And sometimes when women hear this, it's kind of an extra boost to go and try to get your blood pressure under control or diabetes under control, because it is not only important for your health, but it's important also in reducing your risk of developing these cancers. Some of the common signs to look for, a lot of women say, well, how do I know if I have cancer, or what do I look for? One of the good things about endometrial cancer is it usually does present with some symptom or sign, and usually that's bleeding, postmenopausal bleeding. So if you've gone through menopause and haven't gotten a period in 5, 10, 15, 20 years, and all of a sudden you see bleeding, it is definitely cause to call up your gynecologist and get an appointment immediately, because it usually means that something is wrong. Even if it is one tiny little pink spot on the paper when you're wiping, doesn't matter. I have a lot of women who say, well, I only noticed it once, and so I never went to the doctor because it went away. Doesn't matter. Even if it's once, even if it's light, even if it goes away, still please go to your doctor, because it could mean that something's going on. Ovarian cancer. So ovarian cancer is something that, the symptoms aren't usually as obvious as bleeding. And so the symptoms are a little bit more vague. And if you look here, they're kind of symptoms that even I feel on a daily basis. You feel bloated, it might have some cramping, some pain, sometimes, trouble eating, you get full really quickly. Sometimes you have to pee a lot. They're very non-specific. And so because of this, we, tend to not catch ovarian cancer at an early stage because there's no real clear-cut symptom or sign, unlike endometrial cancer that usually has a clear-cut sign, like the bleeding, that makes us catch it early. So we usually, the unfortunate thing about ovarian cancer is that it tends to present at a later stage because the symptoms are a little bit more non-specific. But just because of that, I think it's important I tell my patients and women to kind of pay attention to what your normal status is. If you're somebody that's always been constipated or always been bloated for all your life, well, then that's normal for you. But if you're somebody that never was, and then all of a sudden for, a month or two, you're starting to feel that way despite your diet or what you eat, then you should talk to your doctor about it. So, and a lot of it is kind of paying attention to what's normal for you and then what that change is and how long that change lasts. So in terms of, are there any screening tools out there for ovarian cancer? Unfortunately, no. And that's another problem and reason that we catch it much later, because there's nothing like a pap smear. There's no quick and easy blood test that we can do every year to check or screen for ovarian cancer. The mammogram is great at detecting breast cancer. The colonoscopy is great at detecting colon cancer, but we just don't have it yet for ovarian cancer. And that's one thing that we're really, really, missing a need in this field. So they've looked at tons of different things, and I'm just going to mention two things in case you hear them out there in the community or people talk about them. There's something called a CA-125. It's a blood work, a blood test that you can get, and also just a pelvic ultrasound. And unfortunately, this is not a good screening test for ovarian cancer. They've actually looked at this. There's been a study in England that looks at tens and thousands of women, and they would just draw this blood test on everybody. And there's a normal level. So your test value can either be normal or it could be really high. And the thought was, well, if the CA-125 is really high, then that could mean that you have ovarian cancer. But the problem is it can be really elevated in lots of non-cancer causes as well. So basically anything on this list or anything that kind of really irritates your belly can cause an elevation in this CA-125 in the blood work. So it actually doesn't mean that you have ovarian cancer. If it's normal, it's a little bit more reassuring, but you can also have ovarian cancer with a normal CA-125. So it's not perfect. I don't want to get too medical or technical, but I think that these are really common things that a lot of patients come to me kind of already knowing about or hearing about. I just thought it was important to address that it's not perfect. Doctors should not be drawing them just routinely on everybody. It leads to more confusion and we don't know how to deal with it. So your doctor is not wrong if they're not drawing these things. And same with ultrasounds. Getting a pelvic ultrasound, you should really only have done if you have a reason to have it done. Kind of just getting them done for the heck of it doesn't really do anything. So we don't know how to interpret a lot of the results when that happens. So we need a good screening test for ovarian cancer. Unfortunately, it doesn't exist yet. Another thing I wanted to talk about is family history. So family history can be very, very important for some of the gynecologic cancers. In particular, ovarian cancer, fallopian tube cancer, even endometrial cancer. But these syndromes right here, these genetic mutations, maybe people have heard of BRCA and BRCA 1 and 2. Those are kind of the big ones that people probably have heard out in the community, especially it's associated with breast cancer. So you probably maybe heard it more in that regard, but it can definitely increase your risk of ovarian cancer. Lynch syndrome is something that is out there and associated with colon cancer, as is Cowden syndrome, and they can also lead to an increase in uterine cancer. I just bring them up because it's just really important to kind of talk to your family members. Do you have a strong family history of ovarian cancer, of breast cancer, pancreatic cancer, colon cancer? I think that older generations A lot of these genetic tests weren't available then. And so now that we're coming out with so many more tests and the technology is getting better, we have a lot of really good information out there that can help us. And so, if you think you have a strong family history, then you should talk to your primary care doctor or your gynecologist, because you might be eligible for genetic testing, which could really help determine if you are at an increased risk of cancers. And then you could get the appropriate screening, could get tested, which could also affect your children, et cetera. So again, routine genetic testing isn't for everyone. But if you do, talk to your family members and feel like there's a lot of a certain kind of cancer in your family, it's definitely worth talking to your doctor about. So I kind of put a few just quotes that I hear a lot from patients up that I thought would be good to address, because I think that there are common things out there that I hear a lot. So one of them is, but I had a hysterectomy. That means I don't need to go to the gynecologist anymore. And the other one is, but I get my pap smear that checks for everything, right? And so it's important to go back to this diagram here. So for the pap smear checks for cervical cancer. The pap smear only scrapes the bottom of the cervix down here. It will only tell you if you have cervical cancer or not. It does nothing to tell you about the inside of your uterus. So I have a lot of patients who are diagnosed with endometrial cancer, uterine cancer, and they say, well, I get my pap smear every year and it's normal. So how did it not catch that? It doesn't. It only tells you about the cervix. It's not going to tell you about endometrial cancer, fallopian tube, ovary. It's not going to tell you any of that. So just because you're having your pap smear done, you still need to make sure you're getting everything else checked out and paying attention to your body. And the same with the hysterectomy. The hysterectomy could mean so many things. So the technical medical term for it is that the uterus was removed. But you have to know what kind. Did they take the cervix out as well? Do you still have your cervix? So do you still need pap smears? Did they take your ovaries out, your fallopian tubes? It's kind of like really ask your doctor, what did you take out? What do I still have in? Get copies of the operative report so that you know what kind of screening with pap smears that you still might need, or if you have a new symptom, do you still have your ovaries? Should we be worried about that? And also, even if you had everything out, even if we took out the uterus, the cervix, the tubes, the ovaries, there's still the vagina and the vulva on the outside. And so it really should still be looked at, because you can still get cancers in those areas as well. So it still really is important to see your gynecologist every year and have a pelvic exam to make sure that everything is healthy. So I think that's a really important thing to talk about as well. And then, I just talked about family history, but the one cancer that does not run in families is cervical cancer. And I bring this up because cervical cancer is caused by the HPV virus, and only the HPV virus. There is really nothing else that can cause a cervical cancer. And there are lots of different types of HPV. And it's just a really silly way of saying it, but it's kind of like the common cold of the vagina is what a lot of gynecologists say. And so it's pretty much anybody who's ever been sexually active has been exposed. Over 80% of females, and probably more than that of males, have HPV. It's just kind of this virus that lives everywhere. Most people clear the virus on their own. It doesn't cause problems, but sometimes it can cause problems and can cause cervical cancer. But this cervical cancer is not one of the cancers that can run in families. And cervical cancer can be prevented by getting the HPV vaccine, which is approved up to the age of 46. And that's why once you get HPV, it's really hard to get rid of it. But the best thing to do is to just not get it in the first place. And the only way we can do that is by getting the vaccine young and vaccinating our kids. So I think that I'm a huge proponent of that, and think it's really important to protect young men and women to prevent cervical cancer ultimately. And so finally, just, a lot of patients and women ask, what can I personally do to prevent myself getting cancer, right? Like, it's just, what can I do to take care of myself, to reduce my risk as much as possible? And it's going to sound cliche, but really it's taking care of yourself the best that you can. So following a healthy and balanced diet, again, obesity, hypertension, diabetes, they all lead to really bad things, including cancer. So keeping those under control really, really helps. It has been shown that exercising regularly reduces your risk of cancer, breast cancer, ovarian cancer, really everything. Exercising helps. We're not just trying to yell at people and tell them to move more. It actually does reduce your risk of cancer. Pay attention to your body. So when I brought up all those signs of ovarian cancer, really important to kind of know what's normal for you and what's a change for you, and to talk to your doctor when you notice that change. And to stay up to date with your primary care doctor and gynecologist. It's really important to go every year. And it's really important to go when there's not necessarily something wrong with you. Just going for those annual checkups is really helpful to kind of make sure you're okay, make sure nothing's being missed, figure out what your normal is, so that you're not only going when there's a problem. And doing these things actually really can prevent you from developing cancer down the line. I also put this in, so where can I find reliable information? I mean, the internet is such a scary place out there. Google just really sometimes can be great and lead you to good sites, and sometimes can lead you down a black hole. And I just put these 3 sites up here because they actually do have a lot of good patient and community information. SGO is specific for the Society of Gynecologic Oncology. And really, they have a lot of good patient-oriented materials as well. And so I would really encourage you to kind of use more of these websites and more of the academic websites out there when you're looking for information, because Google, or, if whatever you Google, great, but maybe just always check with your doctor or somebody that you know and trust to make sure that it's a reliable source. And so these are the ribbons for the 5 different gynecologic cancers. And we always go by learn, listen, and act. So learn the symptoms of, some of the major ones I talked about today, listen to your body, and really make sure that, you stay up to date with your doctors and ask us for anything. Even if it's just a question, you can always call my office or call us at any time, and we're happy to help with whatever we can. So that was kind of just a starting point of just common things. I'm sorry if I talk too fast. My kids tell me I do all the time, but I'll take any questions or anything that I can clarify. I'm going to stop share. I'll keep sharing for a second in case you want me to go back to a slide.
Alrighty, we'll give them a few minutes, a minute or two to put any questions they have in the Q&A box. And I'm just going to share the links with everyone of our Thrive membership for Facebook and the regular Thrive membership.
Oh, perfect. Thank you.
I'll give them a minute to write any questions that they may have.
Oh, I see. I see the chat. Oh, great. Oh, I love this question. Sorry, I can see it. At what age may we stop having pap smears? So this is a really good question, and I think it's going to change as we go on. So currently, the guidelines, so there's the American Society of Colposcopy and Cervical Cancer guidelines that are out there that look at hundreds of thousands of women. And the guidelines currently say that you can stop getting pap smears at age 65, as long as you have never had a history of abnormal pap smears. If you have a history of abnormal pap smears, or you have a history of abnormal cells of your cervix, then you need to continue to get pap smears for at least 20 years after you had treatment on your cervix for abnormal pap smears. But 65 is supposed to be the magic number. However, I get pap smears on every single one of my patients, regardless of their age when they come through the door. It doesn't matter if you're 80 or 85. A lot of women, especially that old, have not had a pap smear or seen a gynecologist or anything in 20, 30, 40, 50 years, many since they gave birth to their last child. So I get pap smears on everybody. There was a big study that came out recently in one of our journals for Gynecologic Cancers that said we're actually seeing a rise of cervical cancer in the older population, and it's actually presenting at much later stages in the older population. They are still looking into why is this, but I think part of it might be because we kind of stopped screening at 65, and women are living longer now than they were then. We have a lot more medications. We just have a lot more technology. So women are living to be 80, 90 years old. And so what are we doing in that 30-year gap? So right now, the correct answer is age 65 if you've always had normal pap smears. But I think it'll change. And I think that if you asked for one later than that, then that's okay. Your gynecologist might kill me for saying that, but that's the truth.
The next question is, are you accepting new patients?
I am accepting new patients, but unfortunately you have to have a gynecologic cancer diagnosis to see us. So it's usually you see your regular gynecologist first, and then if you have a pre-cancer, cancerous condition or a pelvic mass or something that warrants a gynecologic oncologist, then you get referred to me through your gynecologist. But definitely you can call my office at any time and talk about why you would want to be seen, whatever your problem or concern is. And I'm definitely happy to see you if it's something that is above a regular gynecologist for sure.
Alrighty, sounds good. Can you see the next question? Oh, right there.
I can. So is it possible that mammograms cause cancer? It seems to me that one per year for 40 years is a lot. That's a lot of x-rays. Is there a better way, less invasive, to check for breast cancer? That's a very good question. The amount of radiation in the mammogram is very, very low. And they have looked at this and added this up over time. And really everything we do is a risk benefit ratio, right? And so sure, there might be a very small chance that that radiation adds up over time, and that is a very small risk. But the risk of breast cancer is 1 in 8 in the general population, which is very, very high. And that's without a genetic mutation. And so the benefits of getting mammograms and the benefits of preventing breast cancer and catching a breast cancer far outweigh that very, very, very small potential risk that those x-rays could add up. And they most definitely would not be doing them if that was something that was common enough and concerning enough. So I really, really am a huge fan of get your mammogram every single year. Every single one of my patients who walks through the door, it's one of the first things I ask. Do you need a mammogram? Do you need a bone density? Do you need a colonoscopy? You don't leave my office without a script for that.
Alrighty, and one more question. If your cervix is closed, is it possible for it to open with estrogen treatment?
So that's a good question. And so I think it's important. I'm going to go back. Sorry. I'm going to use this slide for a second. So if you look down here, the cervix is down here, and this is the top of the vagina. And so as we get older and we lose estrogen, because when you go through menopause, your ovaries stop making estrogen. As we get older, so estrogen essentially makes the cells of the vagina and the cervix plump and healthy and moist. And so when you lose that estrogen, everything becomes very dry and very what's called atrophic, kind of thin and scarred and dry. And so when we talk about the cervix being closed, it could be closed for many reasons, just old age, atrophy, women who've never had kids before sometimes have a closed cervix. And estrogen can be used in the vagina to help with dryness, and it can, if you push it back far enough, and it could also be used on the cervix, but there'd be no real reason to do so. It doesn't really matter at a certain point if your cervix is open or not, if that makes sense. So estrogen itself won't make the cervix open, but it kind of makes the whole vaginal tissue lining environment a little bit more healthy. But you should definitely talk to your doctor, because there are, pros and cons to using estrogen cream and whatnot before you use it. But can definitely, I'm a strong, and can be used in cancer. So even if you have a history of gynecologic cancer, you can still use estrogen cream. I mean, I use it a lot commonly because I do think it helps. Did that answer your question? I hope so.
And one more question. At what age should one get a bone density test?
So in the general population, I believe the age is around like 60, women over 60. However, they are going by certain risk factors now too. So if you are a smoker, if you are an alcoholic, people who are very, very thin, that's why going to your primary care doctor every year, they assess for these things and can tell you if you're at risk and might need it sooner. Women with cancer, I get a baseline bone density test on everyone. Young women in particular with cancer, when they have to go through chemotherapy, surgery, radiation treatments, and we are kind of putting you through menopause too early, I get a bone density. And that's because estrogen on the comes from the ovaries, and estrogen really helps your bones. And so when you lose estrogen, it puts you at risk of things like osteopenia and osteoporosis. So they're really coming out with a bunch of different guidelines based on your risk factors. So you should definitely talk to your doctor about them. And just a tip for everybody out there who's listening, mammograms and bone densities, if you ask your doctor to order them, you can get them at the same visit. So they're usually at the same place. And so this way you don't have to go back and get one test and another. So you can get them done at the same exact time, schedule them, because they're like two really easy imaging tests that they do at the same time. It's get a lot of patients to do it that way. A lot of people don't know that.
Okay, we have one more question. In reference to having dry vaginas, what type of lubricant would you recommend not wanting estrogen based?
Yes, so very good question. So there is, I can type it in the chat if that helps.
Yeah, you should be able to.
Let me just see. So how can I type in here?
So next to share
chat.
screen, in the
Yeah.
chat. If where it says to, just want to make sure that it says to everyone. Sometimes it just says host and panelist.
Type your answer here. Okay. So Luvina is a good, they have estrogen washes, anti-itch wipes, and lubricants. This is a really, did that go to everybody? I don't know. Here. If you go into the answers, you can see. So Luvina is a really good company. It's all natural. There are no scents, it's just a very, very good natural product that I give a lot of patients. There's no hormones in it, really not a lot of processed bad stuff. Some other just regular lubricants. You can obviously, there's KY jelly, but KY jelly gets really messy. And so there is, I'll type again, Reverie is another gel or lubricant that is really commonly used in a lot of young women with breast cancer who need kind of a lubricant. But I will say the Reverie is a little expensive. The Luvina you can buy on like Amazon. And that's another good one. Some women like coconut oil. Do they find that is like a natural thing that works for them? You can try that. I've gotten mixed feelings and reviews about that. And then there's another one. I just want to make sure I spell it right. Let me see. This one. Lubricant. I'm typing it in the answered. So there's Hyalogyne, Hyalogyne lubricant. That's another one that's commonly used, like that I give a lot to my patients. And the medical oncologists do as well, but that's also a little expensive. It's like $60 for a tube, which I think is kind of insane, but some women really like it. And they are all non-hormonal based and really great. One last thing that I will just say, sorry, can everybody see it now? I hope so.
Yeah.
One last website that I'll share, because sometimes this is also a little bit of an embarrassing thing to talk about, but if you go to the Soul Source website, this is about vaginal dilators. And vaginal dilators can be helpful, especially as you get older, as the vagina gets a little bit more thin, kind of more narrow or more shortened, or if you're having, some women who haven't had intercourse for a really long time, but then later in life find a new partner. but then aren't, haven't had penetration or intercourse in a while, using some vaginal dilators with lubricants, I think, is a really great way to get you to feel comfortable with it again, and to also, help if there's any discomfort. So that website, they have a lot of testimonials, videos about sexual health, how to use them. And I think that it's something that we don't talk about as enough as women. And, sexual health is really important regardless of our age. And so I think that I hope everyone can see this in the chat, because I think these are all really good things.